know every 3 out of 4 adults in the United States have some form of gum disease or periodontal disease? The National Institute of Dental and Craniofacial Research estimated that 200 million Americans are affected by this slowly destructive process. It has been proven that brushing and flossing your teeth can help prevent the development and progression of periodontal disease. The National Institute of Dental and Craniofacial Research estimated that 200 million Americans have this disease. So, the goal of preventive dentistry is to accomplish and maintain optimum oral health for a lifetime. With a thorough oral health routine and assistance from dental professionals, superlative oral health can become a reality for everyone. Today we will cover the symptoms, causes, treatment, and how to prevent this severe form of gum disease. I will talk about the importance of visiting dental healthcare professionals regularly, and I'm also going to show and tell each and every one of you how to effectively remove bacterial plaque by brushing and flossing your teeth. It is time to take responsibility for your own oral health and develop valuable preventive habits. Periodontal disease is an infection of the gum tissues that support your teeth. Your gum tissue is not attached to your teeth. There is a shallow crevice between the tooth and the gum. Periodontal disease attacks the tissues just below the gum line, causing the supporting tissues to break down. As the tissues start to break down, a pocket between the tooth and the gum develops. Generally, the greater the depth of the pocket, the more severe the disease. The severity of the disease is classified into 2 main stages, gingivitis and periodontitis. Gingivitis is milder and more reversible and only affects the gums. Periodontitis involves progressive loss of the alveolar bone around the teeth. If left untreated, this disease may cause your gum line to recede, and it may also cause you to subsequently lose your teeth. Some factors that have been known to increase your risk for periodontal disease include chewing or smoking tobacco, systemic diseases like diabetes, certain medications, pregnancy, crooked teeth, defective tooth fillings, or bridges that no longer fit properly. Some warning signs that can signal a problem are gums that bleed easily, red, swollen, or tender gums, gums that have pullen away from the teeth, continuous bad breath or bad taste, permanent teeth that have become loose, or any changes in the way your teeth fit together when you bite. Now, there is a possibility that you may have some form of periodontal disease with no warning signs. That is why it's important that regular dental checkups and periodontal examinations become typical. Going to the dentist will keep your gums and teeth healthy, as well as detect early signs of gum disease, oral cancer, and cavities. The U.S. Department of Health and Human Services recommends that most children and adults should see their dentist for a regular cleaning and checkup every 6 months. People who have a greater risk for oral diseases should see their dentist more than twice a year. Checkups will almost always include a complete cleaning from your dental hygienist, as well as an examination from your dentist. During the cleaning, special instruments are used to scrape below the gum line, removing built-up plaque and tartar that may cause oral health problems. The dentist will also do an examination of your teeth, gums, and mouth, looking for signs of disease or other problems. The goal of the dentist is to help maintain oral health and to prevent problems from becoming serious by diagnosing and treating them as soon as possible. Your dentist may also recommend x-rays. X-rays are used to diagnose problems that may otherwise be unnoticed, such as abscesses, cysts or tumors, impacted teeth, or decay between the teeth. So attending your dental appointments on a regular basis is an essential part of achieving good oral health. Oral hygiene at home is also crucial in order to keep periodontal disease from becoming a serious problem. So today I'm going to demonstrate one of the most common toothbrushing methods. It's called the Bass method. The Bass method, named after Dr. C. Bass, the father of preventive dentistry, is widely accepted and is effective in the removal of bacterial plaque above and directly beneath the gingival margin, which is where the tooth meets the gum. It is the gingival margin that most significantly controls gingival and periodontal infections. So the first thing you want to do is place your toothbrush at a 45-degree angle with the bristles facing towards the gingival margin. You want to focus on only about 2 or 3 teeth at a time, and overlapping within those teeth is encouraged. So press lightly so the bristles of the brush go between each teeth. Vibrate the brush back and forth in short strokes. Count at least 10 vibrations. Then reposition your brush over the next 2 or 3 teeth. Repeat those steps until you have completed cleaning all along the outer surfaces of the teeth. So for the chewing and biting surfaces of the teeth, place your brush on the tooth surface, vibrate the brush up and down, or in small circular motions. Again, only focusing on about 2 or 3 teeth at a time. Overlapping, again, is encouraged. And finally, for the back side of your teeth, closest to your tongue, place your brush in a vertical position. Move the brush up and down in gentle strokes, only focusing on about 1 tooth during this procedure. Now, this method can also be used with any type of electric toothbrush. Removing bacterial plaque in between the teeth is also a critical part of good oral health. Using dental floss is the most effective way of doing this. Hold a 12 to 15-inch piece of floss with your thumb and index finger of both hands. Grasp firmly with about ½ an inch of floss between the fingertips. You want to make sure you insert the floss into each contact area. Press and slide the floss around each tooth side separately and into the gingival margin. Now, there are several different types of floss. There's waxed or unwaxed, thick and extra fine. Research has shown no difference in the effectiveness of waxed or unwaxed floss, so you should use whichever type of floss you prefer. As you can see, utilizing preventive dentistry will optimize the overall health of your teeth and gums. Educating yourselves about the signs and risks of periodontal disease, visiting your dental healthcare professionals regularly, and brushing and flossing your teeth effectively will greatly lower your risk for this disease. Gum disease is a threat to your overall health. Whether it is stopped, slowed, or gets worse depends a great deal on how well you care for your teeth every day from this point forward. Thank you.